here. Thank you so much for joining me.
Thank you for having me.
I have been wanting to have a cardiologist on for a long time. And hearing that you're a cardiologist who also has sleep apnea is like the double whammy. So I'm really excited to
Yeah,
hear your story. We've talked a bunch on my podcast about some of the links between sleep apnea and AFib and different things that can be
sure.
happening that you might need to see a cardiologist for. So, what I'm interested in is, did you learn a bunch about sleep and sleep disorders during med school, or was that later? What level of training do you get as a cardiologist in sleep apnea and the links?
So, certainly you learn a bit about sleep apnea when you're in medical school, and, you learn the pathophysiology of it and management. At the time when I was in medical school, 2003 to 2007, the option was CPAP. And so you learn a bit about it. Actually, at the time, I know that CPAP was out, but it was, I don't know, I saw some really sick patients with sleep apnea at the time. So I'm talking these people who literally in the pulmonary clinic at the VA, for instance, in Chicago when I was there, who would fall asleep almost mid conversation, and had a
Yeah.
real hard time staying awake. And so those were the really profound cases. I don't know that I see that very often anymore, but I think acknowledgement and understanding of sleep apnea has grown a lot. So you get some of that in medical school. And then to the path to being a cardiologist is that after medical school, you do internal medicine training. So I was at the University of Chicago. We're with plenty of pulmonary patients and in the ICU and elsewhere, and you see patients with sleep apnea all the time. So you get a lot of that through your internal medicine training. And then cardiology, while that's not your focus, we have realized more and more over the last however many years that sleep is important and it plays a big role in everything in your body. It turns out you need it, and you need good quality sleep in order to avoid a lot of the scary things that can happen, not just with your heart but across the board. So that's how it kind of all comes together. You see it more and more
Do you
later
think
that.
over time you're starting to see? I feel as though a lot of us, especially women and younger women, have gone quite a long time to diagnosis. And I've talked to a number of doctors where of all different ages. So, especially the older ones have been telling me there really were only ever taught that older overweight men had sleep apnea, and they really weren't looking for that range of different people to have that. So would you do
Sure.
you like recognize that, or you think that you're seeing a range now?
I think there's the bias in medical community, not just myself, but I think across the board, is this stereotypical overweight man, usually with a really thick neck and, stuff like that, like the very classic stereotypes. I think that it's easy to pick up on the very straightforward cases. You have a high suspicion. So even in women, very obese women, you kind of look at them and you just get the feeling like they have a short neck, they have a thick neck. This is probably
Yeah.
somebody who's not got great sleep quality and probably sleep apnea. But I do think that there's probably some broadening of that over time. So, for instance, I think that we've acknowledged or at least recognized that there are certain conditions, not just specifically AFib, although that's my personal specialty, but there's other things as well that if these people have a diagnosis, that we should start thinking about sleep apnea as being a possible reason why they could be having this. So, for instance, like refractory high blood pressure, right? Hypertension. So,
Yeah.
if you have somebody who's relatively young and you get them on an antihypertensive drug or maybe even two, and you're having a hard time controlling blood pressure, even if they're thin, maybe we need to look at the possibility that sleep apnea is at
Yeah.
play here, things like that. So, or atrial fibrillation in young people.
Yeah. So
Yeah,
before we get on to like your journey with sleep apnea, do you want to explain just in brief terms a little bit about what atrial fibrillation is? Because I know it's one of those
sure.
things like a lot of people have never even heard of that, and they don't know it's a thing, and they don't know what kind of symptoms to look for.
Fair enough. I would say this is maybe my bias because I see it every day. I would argue that nowadays, I think that if somebody hasn't heard of AFib, they've probably been living under a rock. At least because I think that it is so ubiquitous now. It is such a common disease. And as the population is living longer, it
Yeah.
is very closely associated with age. And so we know that there's an increased risk of having atrial fibrillation as you get older. And so we're seeing so much more of it. And now a lot of those drugs are advertised on TV, thinking Eliquis and
Right.
Xarelto for blood thinners.
Yeah.
So atrial fibrillation is the most common abnormal heart rhythm in adults. So it's basically a rhythm of chaos. And as a result, there's a myriad of side effects or complications that can happen with AFib. So, do you want me to take 3 minutes and go through my little
Sure.
AFib spiel?
Sure
Okay, so
thing.
yeah, all right.
Are
So
you are you
atrial
picking up
fibrillation.
on the level of nerdiness? Like we're super into
Oh,
it.
well,
We
I
want
hope
to
so.
know all the stuff.
I nerd out on this stuff every
Yeah.
day. So the way I would describe it is I actually, with my patients in clinic, I use my jazz hands. I actually use my hands to describe the electrical system. So for all of your people out there who might see this video, you have atria, top chambers, you have ventricles, bottom chambers, and they're connected by an electrical bridge. And so in normal rhythm, we are in what's called sinus rhythm. There's a piece of tissue in the atrium, top chamber, that fires and makes the heart beat, and so it makes the top chambers contract. The signal goes through the bridge and then makes the bottom chambers contract. So that's how you
Hmm.
get this kind of boom, 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 and then there's a brief period of no beating while the heart's filling, and then so on and so forth. So in AFib, the difference is that what happens is that sinus node has been overridden. There's now electrical chaos. It's like somebody yelling fire in a crowd. Okay, so signals are swirling everywhere on the order of somewhere around 600 beats a minute. And
Oh
so the
wow.
atria just quiver, and that's called fibrillating. That's where we get the term atrial fibrillation. So the top chambers
Okay.
are fibrillating. And then the ventricles, so this bridge, what's called the AV node, actually saves us all because it does not let through all 600 beats. If it did, if the ventricle went into ventricular fibrillation, that is what you see defibrillators at an airport or at a
Right.
mall for. So
Right.
that bridge saves us. It doesn't let through all 600, but it lets through irregular fast beats, 150 beats a minute, 160 beats a minute. And so as a result, people can feel that. They feel the bottom chambers going rapidly and irregular. So they can get shortness of breath, they can get chest discomfort. They certainly, the most common is palpitations, that sort of thing. The biggest complication of AFib is the risk for stroke, which is related to the fact that the top chambers are not fully contracting, they're just quivering, and so blood can stagnate and clot, and then that clot can break off for a variety of reasons, and it just happens to be a straight shot to the brain. So then people have a stroke, but people can also get heart failure and things like that. So
Hmm.
that's the background of atrial fibrillation. It's extremely common. Everything impacts the heart, can cause AFib, but the most common
Hmm.
risk factor is increasing age. So we know that people, when they get to the age of 80, it's not uncommon for people to have about 1 in 5 will have some history of AFib at age 80.
And it's more prevalent in people with sleep apnea versus the general
So sleep
population.
apnea, right. So I don't know the exact numbers off the top of my head, but it does seem to have some correlation. And then
Hmm.
on top of that, there have been studies that show that management of sleep apnea
Sleep
can
apnea.
reduce your recurrence of atrial fibrillation.
Yes.
So they certainly play a part in each other. There's actually disordered breathing that occurs when people have atrial fibrillation. So it may, in its own way, contribute to people having apneic episodes when they
Right.
sleep. But sleep apnea certainly contributes to atrial fibrillation. And so
So
managing that helps.
it's going to be important.
Yeah.
So take us to your own personal journey. When did you first notice that there was something going on?
So I actually probably have had something going on a lot longer than I want to acknowledge. I've
Yeah.
never been.
That's all
I
of
was a
us.
Yeah. I think that's always the case, right? But one of those things, like as a healthcare professional, I probably should have been on this years prior. I've always snored, at least since I've gotten through college. I've never really been thin. My body weight's always been kind of borderline, just shy of obese. That's sort of like BMI of 28 to 30, occasionally creeping above that, rarely creeping below that. And so kind of just dealt with being a snorer and all that since I was in my early 20s. And then I don't know, it's one of those things where it's probably the hard part for me was when you are in medical practice, when you're in medical school and residency and fellowship and all that stuff, you spend so much time working, you spend so much time reading and learning and all that stuff that when you're tired, you don't really know am I tired because I am sleep depriving myself, or am I
Yes.
tired because I'm not getting quality sleep?
And that's one
And
thing I've heard from so many doctors over and over again because of the way that the residency is set up and all the different
sure,
training. Like everyone around you is dead on their feet, exhausted. And so you're kind of like, are they tired like I'm tired? Or you have no way of quantifying
right,
that, right?
right. And
Yeah, we're
part
all
of
just
that is a
tired.
badge of honor that we want to wear, and so it's something that we kind of carry with us. It's like a thing of pride that like you can work through a lot of stuff. I actually like that I worked as hard as I did, but as a result, I don't know if my tired patterns that I experienced from my mid 20s until my early 40s were sleep apnea, or did that come later? It's hard to really know for certain.
So you were
So,
snoring
yeah,
and you had in the back of your mind
I've
that you
snored since I
were
was in my
pretty.
20s. My wife
Okay.
and I, she would note that I snored. She would claim that it was never terrible, but
Yeah.
she also noticed when I was in my early 30s, I lost some weight. It, of course, like it frequently does, it came back. But for a while, for about 2 years, I'd lost some weight. And she thought that my snoring had significantly improved, if not gone away. I was in the throes of my fellowship, so I don't know if I slept better because, again, I was working 80 hours a
Yeah.
week easily. So then, though, in the last few years, I have definitely noticed that, now that I'm in my practice, I work hard, but I'm not working 80 to 100 hours a week like I used to. I should feel a little bit more energy. And then I actually started having more concerns about the fact that I was like sleeping through my alarms for extended periods of time. Like I would snooze 7 times in the morning, that sort of thing. And just kind of felt like it was dragging. I was never somebody that I was like unable to stay awake in the middle of the day. It's just that's never been my problem. I don't fall asleep
Got
during
it.
movies or anything crazy like that. So that stuff was never happening for me, but just getting up in the morning was a real pain in the butt. And then I was actually experiencing really bad reflux, especially
Very
in the
interesting.
evening. So
Yeah.
I'm not a big drinker, but if I had more than one glass of alcohol, or if I had any citrus, like if I'm from Chicago, I love pizza, and if I had a piece of pizza after say 6 o'clock at night, it was not infrequent. It got to the point where I was kind of waking up gagging on my own acid, and it would be really
Yes.
uncomfortable. Occasionally, I'd have to throw up to get it out, and not the sort of things that you really want to be dealing with. And so finally, and then the final nail in the coffin for my sleep apnea was that my wife my snoring got bad enough that my wife would sleep in another room if I fell
Mm.
asleep before her. So, I would just she's always kind of in bed before me anyway, but like if I went upstairs and fell asleep, the next morning I'd
It's
wake up
all
and she
over.
wouldn't be there. And she'd be like, I had to go sleep in the guest room because your snoring is terrible. So,
So
um,
then what did
yeah.
you do? Did she make you go to the doctor or did you
No, it
take
was
yourself
actually
to the
me.
doctor? Okay.
It was actually all on me. All she said was, "Hey, your snoring was bad." She didn't say you need to go get a CPAP or whatever. But I think she had brought up she would tell you she probably brought it up a few times, like, "Hey, your breathing's not right when you're sleeping or whatever." And she would record my snoring just to throw it back at me. But so finally, when that
Because this
happened,
obviously
and
is impacting her sleep too, right? Like
well,
that's
I think that's something that people. I'm sure you've covered this on other podcasts that you've
yeah,
done, but sleep apnea is not just, I mean, it's a you issue at the very base of it. You are the most
right.
impacted, but if you share your room or have a space with somebody else, like it
Yeah,
impacts everybody
for
in
sure.
that area. So she was being impacted, I was certainly being impacted, and so finally I just said enough is enough, and I sought out one of the pulmonologists here at my hospital that I know, and set up an appointment with him. Came in, met with him, and talked it over, told him about the reflux. And I didn't even think that was related. I was like, just,
Hmm.
I should mention I've been getting a ton of reflux at night. And he was
I have
like,
a bunch of episodes for you
mm,
to listen to.
yeah, yeah. And so he was like, yeah, that's your sleep apnea, Adam. And so I was like, oh, okay, that's interesting. And then he set me up for a sleep study, and I had it done at the hotel. Do you want me to go into this a little bit?
Yeah. Was
Sure.
it a home test or it was an in-lab study?
So I got my pulmonologist is great, and he basically says, I'm going to order it, and if your insurance will approve hotel, let's do hotel. If they only approve home, most of the time we get plenty of data to do it from home,
Yeah.
and that's fine. And so my insurance approved hotel, and we have a high deductible plan. So I paid a lot of that. I'm sure they just didn't care because they don't have to cover much. But anyway,
Yeah, that's like
so
us.
yeah, exactly. So I went and to the hotel, and
Do
there's
you
a few,
actually mean
different
a
rooms.
hotel? Or do you mean like a
Yeah.
sleep clinic?
So no, like in a hotel. So our hospital's sleep clinic is actually on the second or third floor of a double tree, basically, that is down the hill from the hospital. So they have basically worked it out where they have like a command room, like they've taken over basically 5 or 6 hotel
I've
rooms.
literally never heard of that.
Oh yeah, so if you at this
That's
hotel, it's
amazing.
like you go up to the second or third floor, and then on the left side, it's like the sleep lab, and they basically have like one room they've commandeered and turned into a command center, and the other rooms are all wired for everything as if it would be a regular sleep lab. But on the other hand, like it's got a bathroom like you're staying in a hotel. It's got, a bed and a TV
Yeah,
and all that stuff. And so, I got
love it.
there, they checked me in, and I was probably the youngest guy there. So they set me up last, and got all the electrodes on my head and the stuff in the nostrils and all that jazz,
What
and the
did you think?
electrodes and
Like, what were you
EKG leads.
thinking with all this stuff on your head?
The heart, the really, to me, the thing that I'm thinking most is, how am I going to fall asleep with this? Because I've had the ability to sleep pretty easily throughout life. You have to when you go through medical school, but at the same time, you're never having this much stuff put onto your head or your
Yeah.
face or whatever. And so you're kind of like, oh gosh, this is going to be really interesting. But what was kind of funny in hindsight is that while these two ladies are putting all these electrodes on me and the straps and all that stuff, I'm chatting with them, and I start asking them, talking to them about sleep studies. And I said to them, well, so back in the old days when I was in training, people would come for multiple sleep studies. They would come and get a sleep study, and then if they were diagnosed with sleep apnea, they would come back for a fitting type
Yep.
study where you would like
Yep.
go
Like a
and sleep,
titration.
and exactly, a titration study. And then they, for a while, they did split night studies, right, where you would
Mm-hmm.
sleep, and they would try to diagnose your sleep apnea within the first half of the night, and then the second half they put a mask on you and try to
Yep.
get it titrated, right, to condense it. And so I said to the women, I was like, do you guys ever do split night studies or anything like that? And the one who was kind of in charge was like, no, like you'd have to have terrible sleep apnea for us to bother waking you up. Like we just let you sleep, and you'll find out like the next day or, later that week from your doctor, and blah, blah, blah. And so I'm like, okay. So they get me all set up. They, get me into bed and turn out the light. And so it takes me a little while to fall asleep because it's hard with all these electrodes on, but eventually I make it to sleep. And so that was probably around 11 o'clock that I got to sleep. And about 2 in the morning, the lights come on. The woman's walking in. She's holding all the CPAP gear. And she's like, you're wearing this tonight.
Yeah.
Yeah, because I had 45 episodes an hour.
Yeah.
So, it was one of those things where it was bad enough that I know people who have scored worse, but people with CPAPs have scored even better than I have. And so I had 45 episodes an hour, and they said that's enough, that we don't need to have you go all night long like this.
Yeah.
With desaturations down into the upper 70s. And so they came in, got me on the mask. I did not sleep well with it that night just because it's a foreign thing. You don't know what you're doing. And then after all that, the next day, I have the luxury. This isn't for everybody, but as a physician at the hospital, I happened to find the pulmonologist just by chance, like up by the cafeteria, and I was like, apparently I have terrible
Hey.
sleep apnea, and he was like, yeah, when one of our cardiologists has bad sleep apnea, I hear about it before like the end of the night. So yes, you have it.
Yeah.
And so he
Yeah.
he basically got the order in immediately for me to get my CPAP, and took about
So
2 weeks with everything to get it.
So there wasn't any discussion of any other treatment option. They were like, you have severe sleep apnea. The treatment for that is CPAP. Let's get it ordered, basically.
As opposed to what?
as
Like,
opposed to let's go and talk to an ENT and look at your craniofacial structure or maxillofacial
oh, I mean,
surgeon or any alternatives to
oh,
that. No.
well, I mean, I suppose you could look at that stuff, and I am not enough of a sleep expert to say the merits or drawbacks of any of those. My dad has sleep apnea, and he actually leaves it largely, I think, mostly untreated. When I was younger, in my teens and 20s, he was trying to get treatment for this, and they did all sorts of things like, you
Oh
know,
yeah,
scarring the back of his,
that
what
was a
his,
long, long time ago.
so at any rate, so he went through all that stuff and it would work for a few weeks and then, or a
Yeah.
few months if he was lucky, and then it would come back. So for me, even if they said, hey, we should look at things, I mean, short of the fact that maybe I think that maybe my septum's a little deviated, I
Yeah.
don't think it would account for me actually having full on apnea 45 times an hour. And so
It's
I,
more like, I mean, you know, you might want to go and listen to some episodes, but some of the ENTs I've interviewed, it's more about getting people where their nasal breathing is much better so they can use like a nasal CPAP and they don't need to use like a
oh,
full
so
face mask. Things like
yeah,
this.
so actually, so to that, oh, okay. So if we're going that route, so it turns out that that's all I use now. So
Okay.
that night they put the nasal on me, and as great as they were over at the hotel, and they were excellent, they don't really do a whole lot of the new time fittings.
Right, right, right.
So they put the nasal on me, the nasal cushion,
Yeah.
which is not the one that goes up the nose, but sits right underneath the nose, and I couldn't figure it out. I was like, and so after like 10
Yeah.
minutes, I was like, just put a mask on me. So they put the,
Yeah.
the jet fighter mask on, and I got through the night. That was fine. And so when I went and got fitted at the actual medical supply store, I sat down and I said, "Oh yeah, I wasn't able to use the nasal cushion." And the woman looked at me and said, "So, Adam, you've been sitting here for 5, 10 minutes while we've been chatting, and I haven't seen you breathe through your mouth once. Like you sit
Hmm.
here when you're quiet." She was like purposefully, I think, like doing other stuff on her
Yeah.
computer. So I was just sitting there, and I
Mm-hmm.
sit like my mouth closed and I'm breathing through. She's like, "You breathe through your nose, so you don't need to be on a full face mask." And also, I have a beard, and I've had it for 10
I
years,
love
and
that she
so
said
that's gonna.
that.
Well,
She's good
so
at her
she just
job.
she was doing her own thing. She's like sitting there, and then she's just like, "You don't breathe through your mouth. I've been
Yeah.
paying attention to you while you're sitting there quietly while I'm doing my work." So she showed me how to get it on and then talked me through some techniques to try to get it to work right. And in particular,
So
like
this was
putting it
nasal
on,
pillows up your nose, or it was
not
just the nasal
the
mask
cushion,
underneath?
just
The
underneath.
cushion. Yeah, yeah,
Yeah,
yeah.
just underneath. Yeah,
Got it.
yeah. And so, yeah, so she like gave me some tips and tricks, and I was able to use it pretty much immediately.
It's
And
awesome.
within a night or two, I was full going. So I have a friend of mine who's same age who started CPAP around the same time, and he struggled for a while to get up to full night usage of the
Yeah,
mask. But
yeah.
for me, it was like I think my body was just ready for it, you know.
So great.
So I think in the last 13 months, I've maybe slept with it once or twice total
Yeah,
without sleeping with the CPAP.
that's
Yeah,
awesome. Yeah,
yeah,
it's really funny because I have like a million people that I interview who it takes an hour and a half because they've been through all this whole saga and they didn't do well with CPAP. And then every so often I'll come across somebody like you and it's just like, it worked out. There's that 40
yeah,
minutes of not having to do a bunch of
yeah.
stuff, so that's awesome. And
And
but the
so
main thing
it's
I
been
want to
great.
know is like how are you feeling? Like are you waking up in the morning with more energy? Do you feel like, now the benefits of the treatment?
Yeah, so what I would say is I guess I started pinning too many hopes on my sleep apnea management. So, I am overweight. I'm working on that. Having more success in the past month, but like when I was diagnosed, I was like, "Oh, this is perfect. I'm going to lose like 20 pounds just because I'm going to have so much
Yeah.
energy." I gained
Yeah.
weight actually. It
Yeah, yeah,
actually,
yeah.
and that guess what? It turns out that if you eat a lot of food and you don't exercise, it doesn't matter if you wear a
Yeah.
CPAP or not.
Yeah.
So
And I
it
think that
didn't
that's
magically like
really different between different people. Like I've heard the whole range of that
I don't think I
experiences.
gained weight. I didn't gain weight because of my CPAP.
Right.
I didn't lose weight because all of a sudden I had my sleep apnea well
Yeah.
managed. So I mean I've never been for lack of energy during the day. I think the biggest The biggest change, I mean, I think overall I've had more energy, but the biggest changes I've noticed are I usually wake up very close or if not on time with my alarm. It's just, I think, habituated that I still hit the snooze, but usually I'm able to get up without any real major issue
Yeah.
within 5 or 10 minutes of that alarm, as opposed to an hour later. And then the other one is I could probably count on two fingers how many times I've had reflux since being, and in particular the nighttime reflux. If you eat something it doesn't sit right, you can have it. But I haven't
Yeah.
had like the nighttime waking up gagging
Yeah. Yeah. Yeah.
reflux that I had
That's a
almost
horrible feeling.
twice a month before I did it. I haven't had any of that. So
Yeah. And
that
how does
was a
your
huge
wife
change.
feel?
So that's the biggest thing. So what's funny is that, just to give some background, I before I wore the CPAP, I said to my pulmonologist, who's a great guy and awesome dude, and I said to him, well, like my wife and I like cuddle when we fall asleep, like spooning or whatever. Like, I don't want to have stuff get in the way of like my usual routine or whatever. And he was like, Adam, the only time I've ever heard a wife complain about CPAP is when her husband fails to wear CPAP.
Right.
And believe it or not, my wife would wholeheartedly agree with that. So she loves it because now I don't snore. And if I do, it's very minimal at all, maybe a breath or two per hour, but not at all like she was having to deal with. So
Yeah.
no more guest room unless, one of us is sick, then we'll move into the guest room. But otherwise, yeah, none of that. Just like if I fall asleep before her, it's not a big deal.
That's great.
So that
Okay,
part's been
so
good.
was there anything else you want to share before we wrap up?
No,
So much for
I
joining
guess
me.
the only thing I would say is CPAP works. There's all sorts of other therapies out there. I have no pluses or minuses to them, but I do think that you got to give it a try before you bail out and say you're not going to do CPAP.
Love that. Well, thank you
Yeah,
so much for joining me.
of course. Thank you.